Hello and welcome to ECG Kid Portal. Today, we are going to learn the paracentesis procedure or tapping of ascitic fluid in detail. Here, the patient in this scenario, 53 male, presented with complaints of abdominal distension, nausea along with difficulty in breathing. As we can see, the patient is tachypneic with a respiratory rate of more than 24. Often paracentesis is preferred in such cases for diagnosis, to analyze ascitic fluid, which is called diagnostic paracentesis, or to relieve tachypnea and other related symptoms, which is called therapeutic paracentesis. In diagnostic paracentesis, only a small amount of fluid is collected, whereas in therapeutic procedure a large amount of fluid is removed. In this video, we will do a therapeutic paracentesis to relieve the symptoms of patient. Let's get started. First, explain the procedure to the patient and obtain written informed consent. Place the patient in bed with the head elevated 45 to 90 degrees. In patients with obvious and a large amount of ascites, locate an insertion site at the midline between the umbilicus and the pubic bone, about 2 centimeters below the umbilicus. Using a 25-gauge needle, place a wheel of local anesthetic over the insertion point. Switch to a larger, 20 or 22 gauge, needle and inject anesthetic progressively deeper until reaching the peritoneum, which should also be infiltrated because it is sensitive. When the needle is advanced, maintain constant negative pressure to ensure lidocaine is not injected into a blood vessel. To choose a needle insertion site, carefully percuss, because dullness to percussion confirms the presence of fluid. If needed, use ultrasound to identify a site, confirming the presence of ascitic fluid and the absence of overlying bowel. In selecting an insertion site, avoid surgical scars and visible veins. If available, mark the insertion site with a skin marking pen. Once you anesthetized area properly, proceed further. Apply pressure on anesthetized area and rub it until dissolves. Please follow all aseptic precautions. For diagnostic paracentesis, select an 18 to 22 gauge needle. For therapeutic paracentesis, select an 18 to 14 gauge needle or a Caldwell needle. Smaller gauge needles lessen the risk of complications, such as ascitic fluid leakage, but take longer to complete therapeutic paracentesis. Insert the needle perpendicular to the skin at the marked site. Alternatively, insert the needle using the Z-track method, which can be done in several ways. One option, pull the skin, insert the needle perpendicularly, and maintain this skin traction until the needle enters the peritoneal cavity. Another option, puncture just the skin and pull it down, then advance into the peritoneal cavity. A third option, insert the needle at an angle, usually 45 degrees, to the skin and advance it. The Z-track method is preferred because it allows the intra-abdominal pressure to help seal the tract after removing the needle and decreases the risk of peritoneal fluid leak. Insert the needle slowly to help avoid puncturing the bowel and use intermittent suction to avoid entering into a blood vessel. Avoid continuous suction because this can cause tissue to occlude the needle tip. Insert the needle through the peritoneum, generally accompanied by a popping sensation, and gently aspirate fluid. For diagnostic paracentesis, withdraw enough fluid, that is 30 to 50 milliliters, into the syringe and place the fluid in appropriate tubes and bottles for testing, including blood culture bottles. For therapeutic paracentesis, if a Caldwell needle is used, advance the outer metal catheter over the needle, then remove the needle from inside the catheter. Attach the catheter to a collection bag or vacuum bottle using tubing. To learn more medical procedure and interventions, please subscribe and support us, and do not forget to hit the bell icon. Thank you.